Greetings everyone, I'm Thiago, a medical student at Federal University of Santa Maria, Brazil, and today I'm excited to share with you my research project titled Predicting the Number of Deaths from Stroke in Brazil using a Mathematical Function. Our presentation is structured into 6 key sections: problem, objectives, methodology, findings, implications, and future directions. Stroke, also known as cerebrovascular accident, stands as one of the foremost contributors to mortality and morbidity on a global scale. Within the Brazilian context, stroke imposes a substantial burden upon both our healthcare infrastructure and societal well-being. It is imperative to delve into the temporal trends of stroke incidence within our nation. Such insight is crucial in fostering the development of nuanced and effective strategies for both prevention and treatment. Despite the crucial role stroke plays, there is still much we don't know about how it unfolds over time in Brazil. We need to dive deeper into the data, analyzing it systematically to gain a clear picture of the stroke landscape in our country. Only then can we develop more accurate methods for predicting and monitoring stroke cases, essential for shaping effective health policies. Our study aims to conduct a comprehensive analysis of stroke-related mortality, specifically focusing on the prevalence of deaths attributed to stroke. We will be diving deep into the data to uncover any pattern that may emerge over time. And ultimately, our goal is to develop a predictive model that can forecast future occurrences of stroke, thereby aiding in more proactive and targeted healthcare interventions. Our methodology involved a retrospective and descriptive analysis utilizing data from the Hospital Information System spanning from 2008 to 2022. We specifically focused on patients aged 60 years or older, examining the prevalence of deaths attributed to stroke not specified as haemorrhage or infarction. Leveraging the Python programming language and the collaborative notebook environment provided by Google Colab, we employed advanced time series analysis techniques to gain insights and construct a predictive function. And then, to obtain the predictive function, we followed these steps. Data reading. We read and interpreted the time series data using Python code within the Google Colab environment. Time series analysis. Employing linear regression, we established a trend line for the time series under study, allowing us to extract its slope and intercept. Adjustment of maximum and minimum lines. After identifying local maximum and minimum points using library functions, we determined 2 additional trend lines that best matched the peaks and valleys of the time series. Definition of amplitude. We computed the average vertical distance between the trend lines of local maxima and minima, assigning this value to the amplitude of the function. Definition of frequency. Utilizing the Fourier transform of the time series data, we determined the dominant frequency from the spectrum, which was then applied to the function. Adjustment of phase. Employing a function within one of the libraries utilized, we determined the phase value, facilitating the optimal fit of the predictive function to the time series. Visualization of results. Ultimately, the results were depicted across 3 graphs. Calculation of mean absolute error, MAE. The mean absolute error of the function in comparison to the time series was also computed. On this slide, we have a graph showing the time series in blue, representing the evolution of the number of deaths from stroke over time. Additionally, 2 dashed lines are shown. A green line representing the trend line of local maxima, and a red line representing the trend line of a local minima. These lines were adjusted to better fit the peaks and valleys of the time series, allowing for a clear visualization of the trends of increase and decrease over time. On this slide, we present the frequency spectrum. This graph illustrates the spectrum of frequencies obtained through the Fourier transform of the time series data. The plot highlights the peaks corresponding to the dominant frequencies present in the data. These peaks provide valuable information about the periodic patterns or oscillations present in the time series, aiding the identification of significant frequency components that contribute to the overall trend. On this slide, we showcase the time series with adjusted function. This graph displays the original time series data in blue, overlaid with the predictive function obtained through the analysis. The red curve represents the adjusted function, which closely follows the temporal pattern of the data. By comparing the original series with the adjusted function, we can visualize how well the function captures the underlying trends and fluctuations in the data. The mean absolute error may serves as a common metric for evaluating prediction or regression models, offering insight into their accuracy. It calculates the average absolute differences between model predicted values and actual observations in the dataset. Essentially, May gauges the typical magnitude of prediction errors, regardless of their direction. Lower May values indicate higher model accuracy, while higher May values signify lower accuracy, with the scale ranging from 0 to infinity. In our analysis, we applied May to assess the predicted function developed to estimate the occurrence of events over time. The calculated May value stood at 28.236. While the May obtained may not be as low as desired, it doesn't negate the utility of the predictive function. It remains a valuable tool for forecasting and anticipating future trends, offering crucial insights for decision-making across different contexts. Additionally, as we access larger historical data sets over time, we can refine our predictive model and enhance the accuracy of our forecasts. The predictive function offers valuable support for planning preventive and therapeutic interventions in municipalities and allocating funds to medical centers nationwide. With stroke imposing a considerable burden on public health resources, this predictive tool stands to improve efficiency in resource allocation. In summary, our research marks a notable advancement in shaping the future of global public health through data-driven strategies to comprehend and forecast stroke trends in Brazil. By sharing our insights at GLOBEHEAL 2024, we aim to stimulate collaboration, innovation, and collective efforts to tackle the urgent public health issues of our era. As future directions, our primary objective is to elevate the precision and applicability of health policy planning through the refinement of our forecasting methodology. Additionally, we will validate the predictive capabilities of our model by integrating supplementary data sets. Through collaboration with public health authorities, we will strategically implement interventions aimed at alleviating the burden of stroke in Brazil. These are our main bibliographic references for this work. And finally, we would like to extend our heartfelt gratitude to the organizing committee of the conference for the opportunity to present our research. We also want to thank all the participants and attendees for their valuable contributions and engagement. And special thanks to the University Federal of Santa Maria for their support and encouragement throughout this journey. Thank you.